population needs it, right? And when they see someone that looks like them, their brother, their friend, going through this, it kind of really sheds a light on, oh, if he can do it, I can too,
Exactly.
right? And I'm glad that you're doing it.
You still be a masculine man, and stuff like that, and it, that's the thing. People mean, like even tell them the truth. Like at some point, they might have to do a rectal exam just to see how hard the prostate is.
Yes,
but
absolutely.
it's a moment. Like compared to
seconds, right?
Seconds,
right?
And I told him I was transparent about the catheter and all that kind of stuff like that, and then that was no joke.
It's not. It's not.
I love the doc, but they hurt.
It's not. No, but I get it.
So just want to help out share. So
that's awesome.
Yeah,
I'm glad that you're doing. I really am glad.
Yeah.
So how you been though?
I'm good. Can't complain. So just want to see what these numbers are looking like for this blood work.
Yeah.
See how it goes. And so can you explain to people what steps we are now, what I did last week, and what we're here for today?
So the last time you were here is right after surgery, right?
Mm-hmm.
So right after surgery, it's the recovery time from prostate surgery is about anywhere, I would say, for a younger patient like yourself, it's really a 1-year recovery period.
Mm-hmm.
But the hardest part, I would say, is the first 6 weeks, which is where we're at now, right? Where you have the catheter and then your body has to, we took the catheter out, your body has to learn a new way, right, to control the urine flow. Mm-hmm. So it's like you're teaching your body and you're recognizing signals in the brain now. Oh, that's a signal, I gotta go pee, right? So it's a new way to kind of control the urine flow. And at this point, it's the worst of it has happened, right? This point now, it's about controlling the urine flow, controlling and seeing if you have prostate cancer still, yes or no. And erections are also a big deal, right? And seeing what's going on with the erections, because erectile function is also affected after surgery. And that can take weeks to come back, or it could take up to a year for some people, right? So it's kind of, that's why I said it takes a full year, because you want to give yourself grace and time with this. But the most important thing is, do I have prostate cancer or not, right? That is the goal. Everything else can be worked on, right? Is the cancer still there or not? And that's what this visit is for today. I'm just catching up with you and kind of chit-chatting, seeing how you're doing, right? So let's go with what we do is we check the same blood test, the PSA that we did prior to. PSA is a protein that's made by prostate tissue, prostate cells. So essentially, if I took all the prostate tissue, all the cells out, your PSA should essentially be 0, right? The lab never just says 0, so it's going to give you some number 0.1 or less, right? And what is your number? Less than 0.04.
Right.
Oh my God.
It's a 3. That's what I'm talking about.
Right. So we did the PSA. Your PSA is undetectable. That is what we want. So this is fantastic.
I know. This is amazing.
Yes, right. Going forward, what we're going to be doing is checking the PSA, right? So after today, you're down to checking it every 3 months.
Okay. I can do that.
Yeah.
I can do that. 3 months, not bad.
Every 3 months, right? So until the 3 months come, I don't want you even thinking about.
Okay.
Don't even think about it until that time frame, right?
0.004.
Yeah.
Sounds good.
Yeah, so that's undetectable. I don't know why they can't just write 0. It would be so easy for everyone. No. But this is wonderful.
Good.
Right?
Good. Thank you.
So this is what we expect from you. Yay for you. Right? So first step, we passed with the A+.
I wasn't that good in school.
Yeah,
I graduated lower percentile.
You are good now. So this is good. So 0.04. So amazing, right? What about urination? How's that going?
It's going good. When I do urinate, sometimes they have a stronger flow than before. So it's stronger.
When you just started.
I'm peeing like I'm 21 years old after a night of drinking beer. So it's strong. But it's in here part, like right where the belt line is at, sometimes I feel like a little, I don't know what it is. Like you can feel a little, I don't know, muscle, whatever it is.
Like a twinge.
A twinge.
A twinge,
And,
yeah.
and inside, also inside the penis, like sometimes at the head or on the shaft, sometimes you feel like the nerves. Because from the tube being in there.
That gets better.
Yeah.
I promise you. It gets better, yeah. But are you wearing pad or diaper?
I'm wearing pads right now.
Okay. And on average, how many per day? Let's say the last week, because that will give me a better idea.
I mean, pads, I mean, I can almost use the same pad the whole day, but probably twice a day I change. Yeah.
He doesn't like to be wet.
I don't like
Yeah. As soon as you get a little chunky,
He's like, that's what I was trying to tell him. I said, come on, we don't change our pad. One little drop, no. You gotta.
I've been buying a pad, but since I was 2.
Stop it. No, but that's actually pretty good. So what I'm hearing from you is that you're mostly dry. Is that correct?
Yeah, it's just like sometimes you get a little like when I cough or laugh.
Yes.
And my friends always try to make me laugh. So
yes.
I'll get a little tinkle, I'm not gonna lie, and that's kind of funny. And then the wet feeling it's a little bugged out.
The moist.
It's the moist. Okay. The diapers were the worst because everything was hot down there. Everything was hot. Everything was. It was just too. And I have a whole nother case of those things. So anybody need some size 2X? Depends. I'll give them to you. You don't have to worry about it.
Yeah.
So.
All right, good. So you're doing actually really well in terms of your urinary control.
Mm-hmm.
So 2 pads mostly dry. That's actually really good. I'm expecting 3, 4, right?
No.
Mostly wet, right?
No.
So you're doing really well.
No.
So you're going to continue the Kegel exercises, right? And as I said, over time, the leakage episodes, even with coughing and sneezing, it gets better over time, where it gets less and less incidences over time, right?
Okay.
All right, and then, so you're not practically stable. All right, what about erections? What's going on there?
I ain't trying. My thing was still kind of soft in that tube. I haven't even tried. I'm not even.
But you said you had the urge.
Like, when you get up in the morning, you see anything. Does it look like you have even slight lift off?
I can't recall really.
You know what?
Sometimes on the couch I'm sitting there, right, and I watch Twitter porn.
Oh,
Keep it real. So,
no, and I'm telling you, this is not because this is like how he actually is. Seriously.
Yeah.
The 6 weeks ago was just after the surgery. This is literally our day.
I'm all thinking.
Every day.
So a little Twitter porn sometimes, it give me feel like a little chubby about to happen, then it just fade out.
Yeah, that's normal.
Yeah.
So if you had to rate the chubby, right? 0 is absolutely nothing. 10 being a really, really strong erection. Well, how would you rate it?
0, nothing.
Where
About 3, maybe 3, 4.
Okay.
Yeah.
That's better than I expected.
Yeah, it's like I can feel it.
Sorry.
But it don't stay. It's just like
You're doing better than I expect.
Yeah.
I expect 0.
Oh.
So if you have a 3, that's already showing that you have potential to improve.
Oh, so I'll be talking to him too, like,
come on, what's up? All right,
so what's the next step?
As I
Do they
told
increase? Do they
you.
increase? I know.
Yeah, so as I told you that it takes 6 to 12 months. This part takes the longest. The urinary control, it gets better much faster. This part takes the longest. You're a younger patient, so a lot of times I find my younger patients, get it back a lot faster. But I'm very realistic with expectations, right? So are you taking the 5s?
Yeah, 5 milligrams.
So then what we do is you continue the 5s, and then we're going to add 20 milligrams, which you take as needed. Okay. So on days you want to try, you would take a 20, right? Girl, get ready. I don't know.
My friends told me about the pump. Well, how does that work?
The pump is something.
Is it inserted into your body?
You don't, boy. You better wait till a year.
No, I'm just saying. Is that true that it really inserted into your body?
Yes, and then you pump it up, and they have like these. Do I have the model? No, I don't. One of the other doctors have it. He does them. But basically, you pump it up, and it basically goes.
That's what you said.
I'm sure. So
it's inserted like into your shaft. And then there's a reservoir in the scrotal sac.
That's why you said you have to press it.
You press the reservoir.
How to pump the pump? What's electric from?
No, it's not electric. It's like a water. It's like a water and a pulley kind of system.
So does the pump sit on the side, or is it always connected to you?
No, it's in your body.
Wow.
No.
Wow.
It's in your body.
No,
So
we're not.
that would be
Focus.
if after a year you're absolutely still not doing
Yeah,
great.
that's like a year from
But
now.
a year or more.
Okay.
But then we have multiple steps before you get to surgery,
Mm-hmm.
right? Other like non-surgical things are the pump, which is the vacuum pump that
Mm-hmm.
some men use, where they put it over the penis and they kind of
That's weird. I'm not doing it.
yeah, and then it kind of forces blood to come into the penis, and then a lot of like people in porn and stuff use that
Yeah.
to kind of get.
I'm not porn. My porn days are behind me now.
Yep.
Oh God! Once again,
I only watch on Twitter.
this is why he's messing the pads, because this is what we do all day. Really?
Yeah, I make myself feel myself.
I know he does.
You want me to send it to Costco again?
Yes, and for people to know, Costco's has the most affordable prescription space and much cheaper than
Yeah,
Walgreens.
they
and
do.
CVS.
They
So
do.
it's-
Also, there's an online pharmacy called Mark Cuban Pharmacy.
Yes.
Oh yeah, Mark Cuban.
Yeah.
Yeah,
So Mark Cuban, yes.
yeah.
Amazing
Yes.
with these type of generic medications. They're amazing with pricing. They only do generic medications,
Mhm.
unfortunately, but amazing
Oh,
prices
yes.
there too.
Mhm.
So I'll send it to the Costco.
And he's taking the 25
Only
on, okay, so still taking the 5.
Correct.
Okay.
And then the 20s would be only on days he wants to try. Now it lasts in the 20s lasts in your system about 36 hours, a day and a half, right? So you never want to take a 20 on consecutive days. You want
Got
to
it.
skip at least a day, between.
Okay.
So let me ask you something. Is my shaft okay to have intercourse?
Absolutely.
Because it
If
still
it's
feels
up,
funny sometimes,
if
you know.
it's up, you use it.
Oh, okay. Ooh, this feels a little funny sometimes.
I know. It's a whole new way. And even when you climax, it's gonna feel weird. It's still enjoyable, but it's a different kind of enjoyment.
Is like stuff gonna come out or?
No.
Okay, so I just didn't know. So
Yeah.
it's just
Little
there.
to
Okay.
nothing
Yeah.
comes out
Yeah.
sometimes in some patients. Little pee comes out. So I tell them
Oh.
empty your bladder before, yeah.
Okay. Well, okay.
So little pee. So
Golden shower?
pee before.
No,
Pee
that's not.
before.
No.
Pee before.
No.
But there's sometimes when
No.
yeah.
That's weird.
Yeah.
That's my life.
That is
Okay.
weird. But like most men who do recover say that, again, it's your body is learning these new signals. So it's still enjoyable, but it's different. Like the feeling is just a little bit different. So you have to do it a couple of times before.
Did you want to ask about the bladder spasms? But you're not having those anymore.
No.
Remember something with the bladder medicine you were asking about?
Oh.
With the oxybutynin and stuff.
Yeah, so what happens sometimes at nighttime, it seems like I will have to, like, say from 8, 7 o'clock, it seemed like I had to go to the bathroom a lot.
Oh yeah.
A lot. It's like, I don't know why it's just that time of day. I
Oh,
was
Flomax also. You don't need Flomax anymore.
Don't need any more?
Mm-mm.
Okay,
Have
that's weird.
Solusin. You don't have a prostate, so
Oh, so I don't
Stop
have,
taking
I just got that yesterday. A refill. Okay, so don't take that.
don't take that one. The Tamsulosin. So only the Cialis, the 5s,
Mhm.
and then the 20s, which I just did,
Okay,
which is as needed.
okay.
But the urgency, frequency of urination, give yourself some more grace. If the next
Okay.
visit you're still having a hard time, there's a lot of med that we can try to reduce the bladder spasm activity from going on. That can help with a little bit with the urgency and the frequency.
Mhm.
But I usually give it a little bit more time because you're still early in the recovery
Okay.
phase, right? So the plan now is you're doing great. Give yourself a lot of credit with this, okay? We're
Yay.
going to be back in 3 months.
Okay.
Right? Yeah. And then you're going to get the PSA done just like you did now, right? About a week before.
Okay.
Right? So what lab did you go to?
I went to Quest in Howard Beach.
What other concerns, what other questions do you guys have?
No, we pretty much touched on ED. We touched on the bladder stuff.
Yeah.
Yeah, I think we pretty much.
My thing was in terms of because now it's been 6 weeks, so
Yeah.
can you lift more than like 20 pounds now?
No
And
restrictions.
okay, and exercise.
Yeah, you want
okay.
to ease
Ease
into
into it,
it.
okay.
Obviously, don't just go and
I know.
start
And then,
to do.
and then
Yeah.
you
100
squat some now. I pee on myself. I know.
Right.
Yeah.
Oh,
Yeah,
absolutely.
I know. I'm going light.
Yeah, so you want to
Okay.
do like, and yeah, definitely. So usually I tell patients if you're squatting, you Kegel, it's not easy to do, but
Mhm.
if you do it a lot, you Kegel and squat. You know
Okay.
what I mean? To kind of hold it in.
Okay.
Yeah, but you will have some leakage, yeah.
Okay.
And he can now go like in the beat, like if we go on vacation
Yeah,
or okay.
Absolutely.
Okay,
Yeah.
cool. Yeah, I
So
think
no,
that was all the
really no
questions.
restriction, but I tell patients just ease into your activities because you haven't done it for a long time, right? So you want
Okay.
to ease into it and just make sure that, you know, you just don't jump and do something really crazy at the first go at it. Yeah,
Okay.
but you can ease into lifting and stuff like that.
Okay.
Yeah.
Cool. All right, getting back, Doc.
All
think that was
right.
There we go. See.
Thank
sister.
you. Thank you so much.
All right. I'll see you guys in 3 months, okay?
Appreciate
so
you.
you can get the scripts up front
Okay.
and you can get the appointment up front too.
All right, bet.
All right.
Thank you so much.
All right,
Appreciate it.
bye.
See you. Enjoy your summer. Till I see you in August.
Too.